The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Welcome to Aging Horizons. On today's show, again, we'll be talking about Medicare. Particularly, we'll be looking at people who maybe have not signed up yet, who's eligible, when you can sign up. And we'll be talking about, during the COVID health emergency, possibly you were eligible to sign up, but you didn't. What are your options and what can we do for you, or our SHIP people can help you with? So, great information. Stay tuned.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare Summary Notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
45 years, 2 packs a day. It's like $80,000. I thought I was just hurting myself until I fell asleep in a chair with a cigarette. The whole house went up, and I lost it all. I knew smoking was expensive, but I never thought it would cost me everything.
I've been shooting since I was young. It's something I've always enjoyed. I wasn't feeling like myself, when my friend noticed. He asked if he could hold onto my guns temporarily. At first, I was a little shocked, but then I agreed. I think he saved my life that day.
Welcome to Aging Horizons. I'm your host, Brian Lamore, brought to you by the Department of Public Health and Human Services Senior and Long-Term Care Division. We're talking about Medicare. We're going to start at the basics, and then we're going to go into some more involved topics that have come about because of the last few years. Joining us today is Kimmy Everman. Welcome to your show.
Hi, Brian. Nice to be here.
You're the social media and outreach person for the Senior and Long-Term Care Division. And let's start at the basics.
Mm-hmm.
When does one become eligible to sign up for Medicare? And then if one does not sign up, is there some problems?
Yeah, once you turn 65, you're Medicare eligible. Mm-hmm. That means, let's back up for a second. You need a certain amount of work credits or work quarters. It's usually 10 years of full-time work is what it really comes down to. Yeah. And then you're eligible for Medicare. Okay. If you have any issues around those years of working, you still want to talk to somebody about Medicare because it might be able to be prorated or something like that. But at any rate, when you turn 65 and you've got the work time in, you are eligible for Medicare A and B and Part D. And also, if you decide Part C, which we've talked about many times here. But there's a caveat for people like that. If you're retired, you have 6 months to get into your, plus your birthday month, to get into your Medicare. But what if you're still working? Yeah. And you have perfectly fine insurance at work? You still want to talk to a SHIP counselor. And maybe we can put their number up on the screen. you still want to talk to a ship counselor about how you can suspend pieces of the Medicare so that you're not penalized later and looked at as coming in late. For example, you get your Part A, again with enough work credits, you're going to get that at no cost. And most employers want you to have that to go along with whatever they're offering you with their insurance coverage. They may want you to have Part B as well, and that's a question you need to talk to your HR folks about, because B, you may not need it if you're well covered at work and you can kind of suspend it. But again, there might be an employer wanting. There might be a rule at your employment that you must have Part B as well. So, and they can make those decisions, your employer can make those decisions, and then the two insurances can work together. But you want to make sure that you find out, because otherwise you're paying a monthly premium for the Part B anyway, and maybe you really don't need to be on it. And then also the Part D, which is of course the medication coverage, that's also one of those things where if you already get great coverage through your employer for a medication, you won't have to take a Part D necessarily, and probably wouldn't be able to. There's only select groups that are allowed to have two insurances that cover Part D or cover medications.
Great. Well, now, listening to you, I think that an individual might think, I have insurance at work, so I don't have to sign up for Medicare. Or they might think that my work insurance is much better. But you need to establish your eligibility. I mean, you need to call up, you need to check out your Medicare eligibility, and then let the two insurance agencies figure out what they're going to cover, but you don't want to exclude one.
That's exactly right, Brian, because unlike folks with Medicare that have a supplement, if you have employer coverage and you also have coverage through Medicare, you're probably covered even better. And the thing about that is that you don't want to assume anything. You want to talk to a ship counselor, you want to talk to your HR people. We have more and more folks that don't want to retire at 65, and more like me, who my retirement age is 67 and a half. So more and more people are staying on, and it's great to have good coverage, but you shouldn't have to pay out for double coverage.
And you won't get double coverage.
Exactly.
They won't both pay.
Exactly.
But it's important to inquire into Medicare, because there's a penalty aspect to that if you don't. Can you explain that?
Sure. If you don't sign up for Medicare when you're eligible, and you don't have what is called credible insurance, which all that means is you have insurance that's as good as or better than Medicare. If you don't have that, if you have nothing and you don't sign up, you could possibly end up with a penalty. And that's a monthly penalty that you keep paying for as long as you have the Medicare. So again, so important, just a little bit of recon first, and go to your local or call your local ship counselor, and they can help you muddle through all of these issues.
Yeah, that's great. And what's important for our viewers to know is that 6 months prior to your birth month and the birth month, you have time to sign up. And you have a little bit of time after that too, don't you? Like 3 months? No? Okay, so you got to sign up.
You need to get it done.
You need to get it done, because that penalty will last the rest of your life on Medicare, and that increases the premium that you pay for it. So if you are working full-time and you have a good insurance there, and once you become eligible, your employer might want you to go partially on Medicare and partially stay on their plan. And we'll talk about that and so much more in just a few more moments, so please stay tuned. You've probably seen some big-name celebrities on your TV lately talking about all the Medicare benefits you're missing out on. But the insurance companies who are paying for these ads may be pushing benefits not available in Montana. Fortunately, help is available from a friendly state health insurance assistance program counselor who can help you sort it all out. It's free, and we screen everyone for eligibility regardless of your zip code. It's Montanans helping Montanans. Call today.
Respite. It's okay to need it. It's okay to want it. Will you provide it?
The hard part about having outside help is that there's not a lot of people out there who can do that kind of work. We've been very fortunate that our Bonnie has been with us for 7 years. I don't know what I'd do without her. I need her in our lives. She's our second mother. And I can't help but think of her that way.
To find out how to change lives, including your own, call 800-224-6034 or visit respite.mt.gov.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
Like many areas in Montana, Helena is nearly surrounded by forest and is at risk of a devastating urban fire. Wind-blown embers from wildfires have ravaged communities like Denton, Montana, and Boulder, Colorado. Now is the time to prepare your home for wildland fire, no matter where you live. Be aware and prepare. Make you and your community a safer place. Visit firesafemt.org, paid for by FireSafe Helena and aired by the Montana Broadcasters Association.
Welcome back to Aging Horizons. I'm your host, Brian Lamore, and continuing a discussion about Medicare, and we're going to transition into a little bit of Medicaid. We'll go some more details of what is happening to sign up and what the ABCs are of Medicare. Differential, so two words, Medicaid, Medicare. Rejoining us, Kimmy Everman, and you know, it's possibly during the COVID emergency that individuals became eligible for Medicare, but they were on Medicaid, and possibly they didn't sign up.
Right.
How important is that, and what are the details of it?
Well, you know, let's just very briefly talk about what we at the state know, and maybe lots of people in the public know of as Medicaid unwinding. And really what that is, Brian, simplistic for sure, but they really were generous with Medicaid during the public health emergency and made sure that as many people as could be covered were covered. And now maybe some of those folks have actually aged into Medicare instead. And maybe they aged into Medicare during part of that 3 years where we were all in our bubble, you know, staying home and not moving. And, you know, I think that those folks need to know that they still have a chance to sign up for Medicare without getting a penalty, but they need to do it within 6 months of the end of they're off of Medicaid. And what I say is, don't wait 6 months. Don't even wait 6 days. Call a SHIP counselor and say, this is my predicament, can you help me? And they'll say, yes, I can help you. We can talk this through and figure out what you need to do. Because, you know, so many of us, during those years where we were just kind of at home. It was traumatizing and difficult for lots of people, and they may have, like myself, put aside some important things now and then because you get kind of down and you don't want to do it. And so we want to make sure that those folks have a chance to sign up for their Medicare and not be penalized. So don't wait. In fact, forget I said any time limit, go right away to your SHIP counselor.
And do it. You know, Kimmy, for our viewers, could you maybe differentiate quickly the difference between Medicaid and Medicare? I mean, they're kind of confusing between the two, and people might think, am I eligible for which?
Yeah, and you know what? I'm going to be very simple with it because I am not an expert in that realm, but Medicare is what adults and adults with disabilities and also adult workers get in the United States for working a total of about 10 full-time years of work. And it's like any other medical insurance.
Yeah.
It's an 80-20 split where Medicare will pay for 80 and you pay for 20. And so it's just a sort of a run-of-the-mill, but pretty great in a way, insurance, where Medicaid is not insurance. Medicaid is a benefit that helps folks who are very low income and make sure that they can get some health care access or healthcare access in general, but it really isn't considered an insurance policy, where Medicare acts more like an insurance policy. And with Medicaid, again, as I said, this is a low income situation if you're having to be on Medicaid, and it's for folks, as I said, for access to care because they're disabled or a myriad of reasons why.
Well, as I remember, Medicaid as individuals says in the past you can't have more than $2,000 in assets, and to generalize, they have health issues that are, I'll say, catastrophic, and to make sure that they do get health care.
Right.
But let's go back to Medicare.
Okay.
And that's for, I'll generalize, seniors over 65. But we have some ABCs. Let's define to our viewers which those ABCs are so they know what it's all about.
Sure. So Part A is your hospital or your major medical. Part B is the part of your Medicare insurance that allows you to go to the doctor and have lab tests done and have treatment and outpatient.
Right.
Part D is the part that's our newest piece, and actually it's not very new anymore. It's our drug coverage, and it's a fantastic benefit, I think, for Medicare beneficiaries. And then we also have a Part C, and a Part C includes all the other parts, A, B, D, together in one, kind of a package. And you buy that from a private insurer.
And you have a certain time period to get the Part C purchased. Every year you have a reevaluation period.
That's right.
And then a window in which to apply.
Right, and just to get people to go to their SHIP counselor, we're not going to talk about how long that window is. We're just going to say, don't take it for granted. The minute you know that you need to take a look, because we do look every year at our plans. The minute you know that you want to change and you have questions, you need to call a SHIP counselor.
And they can help you evaluate your plan. We're trying to close in the second segment so quickly, but we've got a lot more information about Medicare, and it's pretty interesting seeing these exceptions and how they're addressing really major issues in healthcare. And they keep evaluating and adapting and changing. So we'll keep you informed. So stay tuned. We'll be right back, and we'll talk more about Medicare and how it helps you.
Can you say ombudsman?
Ombudsman. Benson?
Uma Doodlesman? Fortunately, you don't have to say it right to get the help of a long-term care ombudsman. If you or a loved one reside in assisted living or long-term care, an ombudsman can help resolve any issue. And these services are completely free and confidential. Now, why don't you try that again?
Ombudsman.
I was the last guy you'd expect to get diabetes. I was a competitive runner and I always took care of myself. So when I was diagnosed, it kind of threw me. But it's really encouraging to know I'm not alone with it. There are a lot of other people going through the same things as I am. It takes some effort. You have to keep after it. Exercise, meds, and diet are the key. But there are a lot of folks who want me to succeed. Diabetes is not the end of the world. With effort and attitude, you can have a normal life.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
Welcome back to Aging Horizons. I'm your host, Brian Lamore, and I continue our discussion about Medicare. But we're broaching the subject of Medicaid, and Kimmy, sometimes, during the pandemic, some individuals were eligible for Medicaid, and now we're into an unwinding period.
Right.
How did they become eligible, and why would the unwinding period apply to them?
Well, during the pandemic, which was referred to as a public health emergency, the rules were softened slightly so that everybody could get access to health care. And now that we're through that and that has ended, the folks that establish eligibility for Medicaid are beginning to do that again by the book, as we have done it for years and as we should.
Yeah.
And so you might find yourself having gotten Medicaid during that time, but you're maybe no longer eligible, but you are eligible for Medicare now because you've aged in. Very important that you pay attention to that and don't, one of the things that I want to really stress to folks is that first of all, make sure that if you are on Medicaid, make sure that the Office of Public Assistance has your current address, because they can't find you to give you the information you need if they don't have your address. If you get a letter from the Office of Public Assistance, please open it immediately. Don't wait. I know it can be frightening. I know it can be really stressful to get a letter and not know what's inside from government.
Yeah.
But this is so important to your access to health care. And we only, we don't want anything to get in the way of folks having access, but we want to send them in the right direction, Medicare or Medicaid, depending on what is their eligibility status. And so I really want to urge folks to not wait. Don't wait. Open it up. Give a call. And if you don't understand something and it's about Medicare and going into it, call that SHIP counselor too.
Yeah, and if you have loved ones that are maybe your children, grandchildren that were on it, maybe you can mention it appropriately to them.
Absolutely,
And,
absolutely. We don't want this process to hurt. We only want to get past the public health emergency and get on with things, and we want to make sure that everybody has a chance to get what access they can get.
What they're eligible for.
Yeah.
Well, as a part of that, Kimmy, we have what we call helping programs, and these helping programs apply to Medicare. And what are they, and how do they benefit the Medicare beneficiary?
Well, they're really, really great. We have some great programs. The first one that I would want to mention is called MSP, or Medicare Savings Program. And that is a helping program that helps people pay for their Part B premiums. And for some people, out-of-pocket costs for Part B. There are levels, so you may make too much for the first level, but maybe you are in the right level financially for the next level. So it's worth it to check it out and see, because that's a big big chunk that's left in your checking account each month if you are getting that.
Right, and that's for like outpatient care, for
Yes,
senior
exactly.
physician.
Yeah,
whatever.
exactly.
Okay.
Then there's also one called LIS, which is the low income subsidy, and that helps with Part D plans, so those drug plans. And there are, there are parameters, but it's a fairly generous program. And again, there are levels, so you may be eligible somewhere along the continuum, and it'll help you pay for that Part D plan, and maybe some out of pocket and that sort of thing.
Yeah.
Finally, we have Big Sky RX. And I just love to talk about Big Sky RX because it's a Montana homegrown program. And what it does is it'll pay a premium for a Part D plan up to they have a bar of costs that they stop at. But what's so great about them is that they have much more generous eligibility rules in terms of assets, and if you have cars and things or houses or whatever, those things don't count. It's really a very generous program, and you just might fit in. And so we always say, check it out. And you can check it out through a SHIP counselor.
SHIP counselor. And it's important you mentioned that there's limits and parameters on income, but it's not one limit on all of them.
Right.
So a SHIP counselor will help you out. Many times people look at one program, say, I'm not eligible, then
I must not be eligible for anything.
Exactly.
And and again, that's why we love the Big Sky RX so much, because the income eligibility is higher, and they don't care about your assets.
Right. And quickly, as we go out here, can you tell us about the Medicare sign-up? When are we eligible?
When we're 65,
Okay.
we have 6 months plus your birthday month to get signed up. And if you're working and you're planning to keep on working and you're insured, be sure you talk to your HR department and your SHIP counselor, because you can have both.
Okay.
And your employer may want you to have both.
And quickly, how do you sign up for Medicare?
You can call 1-800-MEDICARE, you can go online, but best is to call a SHIP counselor.
The counselor, they'll help you out.
Yep.
Well, Kimmy, thank you so much for all your great information. There's so many interesting little things here that we've gone over today, and it shows how a SHIP counselor can help an individual because they don't understand all these things.
Right.
So thank you.
Yeah, absolutely.
We'll see you again next month.
Yep.
And for our viewers, again, our SHIP counselors are there to help you out. They understand these things, but you're also with area agencies on aging, and there are other programs outside Medicare that could help you as a senior. Give them a call, find out, and enjoy your benefits. Thank you for joining us.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.